Jane, my name is Sarah and I'm going to be your nurse today. And today I'm going to demonstrate how to apply 2 different types of enemas. So I would check her wristband, make sure she's my right patient. And is your name Jane? And then she'd say yes. I would verify her identity. Since this is a type of medication, I would check my MAR for do my 6 rights for my medication checks. I would do 3 different checks, check it 3 times. Jane, we're going to have you lay in a position called the Sims position. It's on your left side, and I'll help you just lay into that position because that's the best position to give an enema in, okay? So I'd help her lay in the Sims position. And what this is, Jane, is it's a tube going up your rectum to help you have a bowel movement, okay? Since it's been a little while since your last bowel movement. Put your head down. Okay. Hopefully she stays that way. Now I'd try to keep her covered as much as I could. Now I'd do hand hygiene, put gloves on. Alright, and then the first enema I'm going to do is the retention enema, in which she would try to hold it in as long as possible. Alright, and then I would expose her rectum there. I would make sure there's no skin breakdown or anything like that. I would go ahead and take the cap off and then lube the tip up really well. Alright, Jane, you're going to feel me put this in your bottom, and I want you to take a deep breath and bear down, okay? Ready? 1, 2, 3. And I would put it in about 3 to 4 inches, and then slowly squeeze the solution in, while having a Chuck's pad under her, in case I make a mess. Alright, and then when I'm done, I would instruct her to hold that in for as long as she can, which is usually about 30 minutes to 60 minutes. And then I would ensure that she had a bedpan or a commode close by in case of needing to have a bowel movement, which is ultimately our goal here. So, and then the next enema I'm going to demonstrate is called the Clumsy Enema. This basically cleanses her out. It's used before certain procedures like a colonoscopy, or just like if they're really constipated or something like that. So, and then again, I would check my MAR, do my 3 different medication checks, since it is a medication and you do need a doctor's order for it. Alright, Jane, we're gonna give you a cleansing enema, okay? So what this tube will stay in your rectum a little longer, and you're going to feel some pressure because there's going to be quite a bit of fluid going into you, okay? Now, would you like to sit on a bedpan during this procedure? And then usually I would put a bedpan or Chuck's pad underneath to catch that fluid that does come out of her. And then I would lube up the end here really well before I put it in her. Alright, Jane, I want you to bear down for me and take a deep breath. This is going to go into your bottom here. Ready? 1, 2, 3. And I would slowly push the tube in 3 to 4 inches. I don't want to go beyond that because that has a chance to perf her bowel, which would be a medical emergency. And then I would go ahead and add the solution to my bag here. And then add the soap suds. Alright, and then this usually takes a little while to complete. And I would have a bedpan under her. And when I'm done, I just take it out. And you did really well, Jane. No, that wasn't the most comfortable thing, but we needed you to have a bowel movement. And then I would just help her clean up afterwards. Just gonna clean you up a little bit, Jane, okay? Alright, and then I would take my gloves off there. Help her back into a comfortable position. Alright, thank you, Jane. Is there anything else I can do for you? And I'll just make sure she has her call light and everything like that. And that is how you insert enemas.